Welcome to the IFHP OTHP Eligibility and Billing tutorial. In this tutorial, you will learn how to determine healthcare coverage eligibility for refugee clients and bill for the services provided. All refugees and refugee claimants are entitled to receive healthcare coverage under the Interim Federal Health Program, or IFHP, and the Ontario Temporary Health Program, or OTHP. With the help of this tutorial and the accompanying administrative resources, the processes of determining eligibility and billing through these systems can be easier than you think.
The majority of refugees in Canada are convention refugees who have documentation identifying them as permanent residents. Convention refugees are granted OHIP upon arrival. Conversely, refugee claimants are those who are forced to flee their home country for Canada without acquiring this documentation, instead making a claim for refugee status after their arrival. While refugee claimants are not eligible for OHIP, they are still eligible for health coverage under two distinct insurance programs, IFHP and OTHP. Both of these systems are billed through Medavie Blue Cross, a Canadian medical insurance company. IFHP offers refugees and refugee claimants different types of basic health, prescription drug, and supplementary coverage. Meanwhile, OTHP offers basic health and drug coverage for claimants no longer covered by IFHP as a result of recent cuts to the program. As a supplement to IFHP, only claims rejected by IFHP can be submitted to OTHP.
Since IFHP and OTHP are separate from OHIP, different steps must be taken to bill for services through these programs. These steps are explained in the IFHP OTHP billing tool contained in this package. Before you can bill through IFHP or OTHP, you first must register as an IFHP provider by following the steps described in Section 1 of the billing tool. You will then receive an IFHP provider number that you can use to log into the online Medavie provider portal. Now that you are a registered IFH provider, let's run through an example to illustrate the entire process of determining eligibility and billing for a refugee client. Adam is a refugee claimant who is not sure what type of health coverage he has.
When Adam arrives at the clinic, the first step is to determine his eligibility. Before using our administrative resources, you should first check if Adam is eligible for OHIP. This can be done by asking if you can see his health card. If he does not have an OHIP card, don't assume he doesn't have OHIP coverage. If he is a permanent resident of at least 3 months, or is a convention refugee or other protected person, he may have OHIP coverage, and you can refer him to the nearest Service Ontario or OHIP kiosk to register for a health card. Since Adam does not have OHIP coverage, you should ask if he has his IFHP certificate or refugee protection claimant document. If he does not have either of these documents, or if his document is expired, he cannot access IFHP or OTHP coverage, and he should refer him to a local community health center or uninsured clinic for care. To ensure that he does get the coverage for which he is eligible, you can provide him with information about acquiring or renewing his IFHP coverage using the IFHP client application tool. You can refer Adam to a local settlement service that can guide him through this process.
However, since Adam does have a valid IFHP document, you can determine his IFHP coverage directly through Medavie, as described in Section 3 of the billing tool. You can provide Adam's client ID to Medavie either through calling in or using the provider portal. According to the system, Adam has basic coverage and PHPS prescription drug coverage. These coverage types are defined at the bottom of the eligibility tool. For more detailed information on what specific services fall under each coverage type, you can view the IFHP and OTHP benefits grids on the Medavie Blue Cross website. You can use the IFHP OTHP eligibility tool to determine your client's OTHP coverage, as this cannot be found through calling Medavie or using the online Medavie system. Additionally, if you do not have access to Medavie, you can use this tool to determine your client's coverage. This tool can therefore help physicians and social service providers determine present or future coverage for the purpose of planning treatments or referrals. Let's try using the eligibility tool with Adam. Start by working down the left side of the table, asking Adam which client characteristics are applicable to him. The topmost relevant coverage type on the right will then apply. In this case, Adam is found to have OTHP prescription drug coverage, in addition to his IFHP basic and PHPS prescription drug coverage.
After the healthcare service is provided, you can bill for it with the help of the IFHP OTHP billing tool. Section 3 of this tool walks you through the steps required to submit a claim for a service covered by the IFHP. You can expect to receive payment within 30 business days by check or direct deposit by electronic fund transfer. OTHP provides basic and drug coverage for those who fall under two specific IFHP coverage types, Type 3 IFHP clients who require prescription medications, and all Type 4 IFHP clients. For these clients, you must collect several documents, including a copy of the client's IFHP certificate or Refugee Protection Claimant document, as well as an OTHP consent form and IFHP claim form, both signed by the client at their initial visit. To bill for OTHP, you will eventually need to prove that your initial claim to IFHP was rejected. Refer to Section 4 of the billing tool for a full description of the billing process and requirements.
In summary, make sure you register as an IFHP provider to start billing through IFHP and OTHP. When a refugee or refugee claimant arrives in your office, you can simply check if they have OHIP coverage, then determine eligibility through MEDAV or by using the IFHP OTHP Eligibility tool if you don't have access to MEDAV or the client ID number, and finally bill for services with the help of the IFHP OTHP billing tool, collecting certain documents specified in the tool if the client requires OTHP coverage. We hope that you now have a better sense of the healthcare coverage offered to refugees and refugee claimants in Ontario, and how you can bill and be remunerated for providing care. The information presented in the IFHP OTHP Eligibility and Billing Tools are drawn from resources published by Citizenship and Immigration Canada, the Ontario Ministry of Health and Long-Term Care, and MEDAV Blue Cross as of April 2015. Links to the original sources are included in both tools, and you can refer to them should you require clarification or further detail. You can also contact MEDAV Blue Cross directly for information on both billing systems.
With a bit of practice, you can become more efficient in providing the care that all refugees and refugee claimants are covered for. We encourage you to share these resources with your colleagues. The attached poster provides a link to the tools and can be used to spread awareness in your workplace about refugees and refugee claimants' right to health care. It is our duty to ensure that all refugees and refugee claimants in Ontario receive the healthcare services to which they are entitled. We thank you for your time and support of this shared responsibility.